Why botulism is paralysis in a can? You're at a family dinner and someone passes you a jar of homemade pickles. They look perfect, crisp, bright, green, floating in clear brine. Your aunt made them 6 months ago. She's been making them for years. Everyone loves them. You take one. It tastes normal. Maybe slightly different than usual, but nothing alarming. Nothing wrong. 12 hours later, you wake up and everything is doubled. Not blurry, doubled. 2 of everything, 2 alarm clocks, 2 doors, 2 versions of your hand when you hold it in front of your face. You blink hard, rub your eyes, nothing changes. You try to sit up and the room tilts. You grab the nightstand to steady yourself, but your hand feels weak, clumsy, like your fingers aren't quite responding. You walk to the bathroom and look in the mirror. Your eyelids are drooping, both of them, hanging heavy like you haven't slept in days. You try to open them wider, you try to raise your eyebrows, nothing happens. Your face just hangs there, slack, expressionless. You try to say something to call for help, but your voice comes out thick, slurred. Your tongue feels swollen, heavy. The words don't form right. And then you try to swallow. And you can't. Not choking, not gasping, just unable. Your throat won't work. The saliva in your mouth pools. You try again and again. Your body has forgotten how to do the thing it does automatically thousands of times a day. By the time someone drives you to the hospital, your breathing is shallow. Your chest feels tight. Not painful, just weak. Like your lungs aren't expanding properly anymore. The doctors take one look at you, the drooping eyelids, the expressionless face, the difficulty swallowing, and they know immediately. They intubate you within minutes, put a tube down your throat, connect you to a ventilator, because they've seen this before. Rare, but unmistakable. You have botulism, and the toxin that's shutting down your muscles one by one, nerve by nerve, is the most lethal biological substance known to science. 1 gram could kill 1 million people, and it was in that jar of pickles. Botulism doesn't start with bacteria infecting your body. It starts with bacteria that have been growing in food, quietly, invisibly, producing poison. The bacteria Clostridium botulinum is everywhere. In soil, in dust, on vegetables. You encounter the spores constantly and they do nothing to you. Because in the presence of oxygen, the bacteria is harmless, dormant, but when those spores end up in a sealed container with no oxygen, a canned jar, a vacuum sealed bag, and the conditions are right, everything changes. The bacteria wakes up, starts multiplying, and begins producing a toxin, botulinum toxin, the deadliest substance on Earth. It takes an amount so small you can't see it, can't weigh it, can barely measure it to kill you. We're talking nanograms, billionths of a gram. And you can't detect it, can't smell it, can't taste it. The food looks normal, tastes normal, maybe the jar lid was bulging a little, maybe it hissed when you opened it, or maybe it seemed completely fine. You eat it, and the toxin enters your digestive system. It doesn't get broken down by your stomach acid. It doesn't get neutralized. It just gets absorbed into your bloodstream. And then it starts hunting for your nerve endings. Here's how your muscles are supposed to work. Your brain sends an electrical signal down a nerve. When that signal reaches the end of the nerve releases a chemical messenger called acetylcholine. That chemical crosses a tiny gap and binds to receptors on your muscle fiber, and your muscle contracts. This happens constantly, automatically, breathing, swallowing, blinking, moving your eyes. Every movement requires this process to work perfectly. Botulinum toxin destroys it. The toxin binds to the nerve endings and cleaves specific proteins that allow the nerve to release acetylcholine. Once those proteins are cut, they can't be repaired. The nerve is silenced. Your brain is still sending signals. Your nerves are still trying to fire, but the message never reaches your muscles. So your muscles just stop responding one by one, starting with the most delicate movements. Your eyes, your face, your throat. The first thing you notice is your vision, double vision, blurred. Your eye muscles aren't coordinating properly anymore. You can't focus on anything. Then your eyelids start drooping. You can't hold them up. Not because you're tired, because the muscles aren't receiving the signal to contract anymore. Your face goes slack, you try to smile, nothing happens. You try to raise your eyebrows, nothing. Your facial expression is frozen, blank. You try to speak and your words come out garbled, thick. Your tongue isn't moving right. You sound drunk even though you're completely sober, completely lucid. And then swallowing becomes impossible. You try to drink water and it just pools in your mouth. You try to swallow and nothing happens. The muscles in your throat won't contract. You start drooling. Not because you want to, because you can't swallow your own saliva anymore. It just accumulates and spills out. This is when the terror sets in. Because you're aware of everything. You know your muscles are shutting down. You know what comes next. You're breathing. The paralysis spreads downward. Your neck muscles weaken. Your head feels heavy. You can't hold it up. It lolls to the side. Your shoulders, your arms, they feel like dead weight. You try to lift your hand, it barely moves. You try to grip something, your fingers won't close. You're still conscious, still thinking clearly, still feeling everything, but your body is shutting down around you. And then it reaches your diaphragm, the muscle that controls your breathing, the muscle that keeps you alive. It starts weakening. Your breaths become shallow, rapid, ineffective. You're trying to breathe, but your chest isn't expanding properly. You're not getting enough air. You can feel yourself suffocating, slowly, while fully conscious. This is when they put you on a ventilator. Because if they don't, you'll die from respiratory failure within hours. And here's the nightmare part that no one tells you. You're awake for all of this. Botulism doesn't affect your consciousness. It doesn't dull your mind. It doesn't make you delirious. You're completely aware, completely present, feeling everything. You can't move, can't speak, can't breathe on your own, can't swallow, can't blink, but you can think, you can hear, you can feel. You're trapped inside a body that won't respond to anything you tell it to do. You're locked in, and you'll stay locked in for weeks, maybe months. There's no antidote that reverses botulism. There's an antitoxin that can neutralize toxin still circulating in your bloodstream, but it can't undo the damage already done. Once the toxin has severed those proteins, they're gone. Your body has to grow new nerve terminals, regenerate the connections, reestablish communication between your brain and your muscles. That takes weeks, months, sometimes longer. So you're in the ICU, intubated, on a ventilator, fed through a tube, unable to move anything except maybe your eyes, unable to communicate except maybe by blinking, and you wait. Some people recover fully. After months of ICU care and months more of physical therapy, their nerve endings regenerate, their muscles start responding again. But the recovery is slow. You have to relearn everything: how to swallow without choking, how to form words, how to walk, how to use your hands. And some people don't recover fully. They're left with lingering weakness, chronic fatigue, difficulty swallowing, breathing problems that persist for years. And some people die. Even with modern medicine, botulism still has a mortality rate of 5 to 10%. You die from complications, pneumonia, blood clots, infections, or your respiratory system just fails despite the machines. Here's what makes botulism uniquely horrifying. It's not violent, it's not painful, it's not dramatic. It's just progressive shutdown. Systematic, methodical, unstoppable. You're not in agony, you're not convulsing. You're just gradually losing the ability to control your own body while remaining fully conscious and aware. And it happens because of food, something you ate, something that looked completely normal, tasted completely normal, something someone made at home with love and care. Most cases of botulism come from home-canned foods. People who don't realize that if you don't heat the food to the right temperature for the right amount of time, the botulinum spores survive. And in that sealed jar, oxygen-free, low-acid, room temperature, they thrive. Green beans, asparagus, peppers, pickles, salsa, canned meats. All of these can harbor botulinum toxin if they're not processed correctly. Here's the darkest irony about botulism. The same toxin that paralyzes you is also used cosmetically, Botox. Botulinum toxin, injected into your face to temporarily paralyze muscles, to smooth wrinkles. It's the same toxin, the same mechanism, just in microscopic, controlled doses, injected precisely where it's wanted, wearing off after a few months. The difference between a cosmetic injection and lethal poisoning is dose and delivery. A Botox injection contains a few picograms of toxin, trillionths of a gram, enough to paralyze a few tiny facial muscles for 3 months. Foodborne botulism can contain nanograms, billionths of a gram, thousands of times more, enough to paralyze your entire body for months or kill you. Same toxin, different outcome. Botulism is preventable. Completely preventable. Don't eat food from bulging cans or jars. Don't eat food that smells off or looks discolored. Don't eat home canned goods unless you're certain they were processed correctly, pressure canned at the right temperature for the correct duration. If you're ever unsure whether something is safe, throw it out. Don't taste it. Don't risk it. Because the consequences aren't worth it. You don't just get food poisoning. You get paralyzed. You lose the ability to move, speak, swallow, breathe. You spend weeks or months in the ICU hoping your nerves regenerate. All from one bite, one jar, one meal. That's the horror of botulism. Not that it's common, but that it's invisible, undetectable, silent. You think you're eating preserved vegetables. You're actually consuming the most lethal biological substance on Earth. And by the time you realize something is wrong, by the time your vision blurs and your face goes slack, the toxin is already at work, already severing the connections between your brain and your body, already locking you inside yourself. And all you can do is wait, trapped, conscious, unable to move or speak, while your body slowly tries to rebuild what a few nanograms of toxin destroyed.